I'm Executive Director Kevin Robertson, and this is the KDA Video Minute for Thursday, December 29th. Dental Day 2012 will provide the perfect opportunity for KDA members from across the state to come to Topeka to speak to their legislators about important issues that will affect dentistry in the coming year. Of course, the main issue that we'll be looking at is supporting our comprehensive oral health initiatives that will create an equal access environment for all Kansans. As January approaches, that can only mean the beginning of our 2012 Kansas Legislative Session, which will begin on the second Monday of January, which is January 9th. And we'll have a full slate of legislative activities this session. Of course, first of all, we have the Comprehensive Oral Health Initiative that the Kansas Dental Association has been working on. Began last year. We'll continue to tweak and work on this coming year so that we can provide access to care to all Kansans, as all Kansans deserve a dentist, regardless of their socioeconomic status or their geographic location in our state. Of course, with that, we'll also be working to oppose efforts by the Kellogg Foundation-backed groups that would create a dental mid-level or a non-dentist provider registered dental practitioner in the state of Kansas. Of course, this fall has been very busy with efforts on both sides regarding the registered dental practitioner non-dentist provider. Those people that support that have had several press releases and news opportunities, including the announcement that Fort Hays State was interested in providing a baccalaureate program for training the registered dental practitioner. Of course, Fort Hays State does not have such a program, and a program could only be instituted if the legislature were to pass such a provider in our state. Of course, the Kansas Dental Association will be supporting our comprehensive oral health initiative. And during the last year and into the fall, we've been working on ways that we can implement those pieces of that oral health initiative with or without legislative action. One example of that is the loan repayment program, where the KDA has teamed up with Delta Dental Foundation to create what we're calling the Kansas Initiative for a New Dentist, or a KIND program, which will be a loan forgiveness program targeting those dental deserts in our state with an incentive, loan forgiveness incentive for new dentists to locate in those areas. Delta Dental will be putting up a significant amount of money over the next 3 years, and we will be trying to get further funding from the Kansas legislature to help further incentivize those areas for dentists to locate. We'll be hearing more about this program as members of the KDA and Delta Dental Foundation work out the particulars on how that program will work. And we'll be making an announcement regarding that during the February 2nd Dental Day. Other pieces of the Comprehensive Oral Health Initiative that the KDA will be supporting this year include the ability of dentists that are retired to maintain their license without payment so that they can do charitable work. That would be a special volunteer license that will be asking the legislature to enact, as well as expanding the immunity for dentists that provide care to free of charge in their office. You know, right now, if a dentist comes to a K-mom, for example, they are covered by the Charitable Healthcare Provider Act and are immune from liability. However, if a dentist, for example, did a similar mom-type project in their office where they work with social service agencies or a Give Kids a Smile type situation, those patients that dentist is providing free care to in their office are not covered under the Charitable Healthcare Provider Act, so the dentist providing that care is not immune. So we'll be looking to extend that umbrella of immunity to dentists doing charitable care in their office. Of course, we'll be also looking again at expanding Medicaid, perhaps funding those waivers that in the past had been granted and are now non-funded, like the frail elderly waiver, the disabled waiver, and dentistry for pregnant women as well. Also, the funding of the Donated Dental Services Program is high on our priority list, and we've been talking with the governor's office throughout the fall and into the start of the year to see if we can't get that $70,000 state funding reinitiated and reinstituted within the governor's budget that he'll be submitting to the state legislature. Of course, we appreciate all the support that our members have given throughout this entire year, talking to legislators, being involved in the legislative campaigns as we're now less than a year away from the 2012 elections. So appreciate all those efforts that have been put in place to try to create opportunities and relationship with legislators. Of course, another opportunity to do that and to continue that will be Dental Day 2012. Our annual legislative activities will be held on Thursday, February 2nd, in Topeka at the Capitol. We'll begin the day at Dillon House. Remember, for those of you that have attended in the past, that is right across the street west on 9th Street from the Capitol. So we'll start at Dillon House. We'll have a press conference to announce our new loan forgiveness partnership with Delta Dental Foundation. We'll have an opportunity to talk to legislators. And again, then we will see about any hearings or other things that might be on for that day. But we're very excited about Dental Day 2012. We really think it's important for you all to come. Last year, the Wichita District brought a bus of members up to participate. We know that they plan to do that again, and we hope that some of the other districts will encourage their members to participate by providing transportation, which the KDA could be part of as far as helping to reimburse districts that want to do that. So if you're interested in that, please contact us. And please, this is a very important year to be involved in Dental Day and talk to your legislators. So please mark off February 2nd, Thursday, February 2nd on your calendar, and plan to be in Topeka to talk to your legislators about all these important dental issues. Back in November, the Lieutenant Governor announced the conclusions that came from his year-long study of the Medicaid programs in the state of Kansas. To give you a brief background, Medicaid costs were rising, and the state doesn't have any money. That's about as brief as we can be. So the governor's office, through the lieutenant governor, was looking at ways to reduce the cost of Medicaid. So the lieutenant governor held some informational forums throughout the state, and in November announced the findings and what the plan is moving forward for the state. That plan is to create a managed care network for healthcare for Medicaid, and it would include both healthcare and dental care, the way it's being proposed right now. So what is envisioned is a new Medicaid program that would provide 3 different opportunities for Medicaid recipients to choose from. So there would be 3 different health insurers or managed care insurers, if you will, that a Medicaid person could choose from. And then there would be a dental component tied to each one of those health insurers. Now, they could be all the same health insurance contract. They might be 3 different ones. So, for example, right now in the mail, over the last month, you've probably received information from Delta Dental, Scion Dental, DentaQuest, and perhaps even Centene Dental. Those are the 4 providers or vendors that we know are interested in the bid for dental services in the state of Kansas. Now, it's possible that 3 separate vendors could be chosen, or 1 vendor could be chosen to partner with the state with different health insurance. But we know there's going to be changes within the landscape of dental Medicaid. That will take effect on January 1 of 2013. So a year from now, there will be changes in dental Medicaid unless we're able to have a further discussion with the administration and talk to them about some other opportunities and alternatives. My understanding is that the rates that will be offered for dental, the current rates that are out there in the fee schedule will be the floor. So we expect that whoever gets the dental contract, or whatever companies get the dental contracts, will offer nothing less than what's currently being provided. But then as far as claims processing and things like that, they could be different. We don't know how that's going to all shake out. Now, if you can sign up for one dental provider or be in one network for one of these companies, or you could be in all 3 of them, If you're in at least one of them, you would be considered a Medicaid provider. For example, if someone like a Delta got the contract along with, let's say, DentaQuest, just for argument's sake, and you were a Delta provider and you had a patient from DentaQuest come to your office, that patient would be treated, or you would be treated as a non-participating provider within the Medicaid system. They could come see you, and then you would be reimbursed at 90% of whatever the DentaQuest fee schedule is. So it will work a lot like third-party insurance, but beyond that, we're not really sure about how the entire system will work. We'll keep you up to date, and we'll continue to work with the administration on explaining to them the benefits of the current fee-for-service schedule, which we believe, in the most part, is working much better than it has in the past. As I mentioned earlier, the legislative session begins on Monday, January 9th. Look for the return of the Video Minute on a more regular basis, weekly, beginning that week of January 9th and continuing throughout the legislative session. I hope you will look forward to the Video Minute and stay tuned as to what we're talking about and updated with regard to the legislative issues. With that, I hope you had a happy holiday, and we wish you a happy new year and a happy 2012. Thank you.